Hello, my name is Jenna. For my presentation, I will be talking about human papillomavirus, and also known as HPV. Alright. So what is HPV? HPV is a small double-stranded DNA viruses that infect cutaneous and mucosal epithelial tissues of the genital tract and hands or feet. It also commonly causes warts. 79 million Americans, most in their late teens and early 20s, are infected with HPV. There are more than 100 varieties of human papillomavirus. Some types of HPV infection cause warts, and others can cause different types of cancer. HPV is the most common sexually transmitted infection. It is most commonly spread during vaginal and or anal sex. HPV can be passed even when an infected person has no signs or symptoms. Sometimes it takes a year or years or even decades after a person is infected to develop symptoms, which is why it's very important to get tested often, and for women, definitely get their pap smears every 3 years. Sometimes it takes a year. I just read that one. HPV can also be transmitted through cuts of the skin or skin-to-skin contact with exposed warts, and that is why people sometimes get warts on their hands, on their feet, on their face, and I'll talk more about that. Anyone who is sexually active can get HPV. Even if you have had sex only with one person, you can develop symptoms years after you have sex with someone who is infected. This makes it hard to know when you first became infected, because it can take years, even decades, to show symptoms. Moving on. Signs and symptoms. Genital warts appear as flat lesions, small cauliflower-like bumps, or tiny stem-like protrusions. In most cases, actually, your body's immune system defeats an HPV infection before it creates warts. And with genital warts, in women, genital warts mostly appear on the vulva, but can also occur near the anus or the cervix of the vagina. And men, genital warts appear on the penis or scrotum around the anus. Genital warts rarely cause discomfort or pain, though they may itch or feel tender. There's also the common warts. Those are the ones that I mentioned earlier. They appear rough, raised bumps, and usually occur on the hands and fingers. In most cases, common warts are simply, they're usually just a pain just for the appearance, but they can also be painful and susceptible to injury or bleeding. There's also plantar warts, which are hard, grainy growths that usually appear on the heels or balls of your feet. Plantar warts can cause discomfort. And then there's flat warts, and those are on your, the flat warts, they can appear anywhere, but children usually get them on their face, and men tend to get them on their beard area. And women also tend to get them mostly on their legs. Here's what genital warts looks like. Not a pretty picture, but it's important to see what it looks like. Here's common warts. As you can see, it appears on the hands. This can be removed from just from a doctor to prescribe medication. Here's plantar warts, also on the hands. They appear on the feet as well. And then these are the flat warts that appear on the face. And yes, the HPV does cause cervical cancer. So there's there's actually much more than two. There's over 100 different types of HPV. There's HPV that causes warts, and then there's also HPV that causes cancer. Typically, the type of HPV that causes warts will not also cause cancer. So if you so for patients who do develop warts, I mean, there is the possibility of them getting the other type of HPV as well, but it doesn't mean that warts will lead to cancer. HPV is the cause for nearly all cases of cervical cancer. And cervical cancer may take 20 years or longer to develop after an HPV infection. The HPV infection and early cervical cancer typically don't cause noticeable symptoms, which is scary, that there's no symptoms besides going for the regular pap smears. It's kind of hard to know whether or not you have it. The types of HPV that can cause genital warts are not the same as the types of HPV that can cause cancers. I mentioned that earlier. HPV can cause other cancers, including cancer of the vulva, vagina, penis, or anus. It can also cause cancer in the back of the throat, including the base of the tongue and tonsils. That is usually caused by oral sex, when cancer is developed in the throat. Pathogenesis. HPV infection occurs at the basal layer of stratified squamous epithelial cells. You can see here it's an uninfected epithelium, and then here it's infected. It's susceptible to the virus. HPV infection occurs at the basal cell layer of the stratified squamous epithelial cells. Infection stimulates the cells in the epithelium. Infected cells display a broad spectrum of changes ranging from benign warts to abnormal cell development and to cancer. Epidemiology. About 79 million Americans are currently infected with HPV. Before HPV vaccines were available, about 340,000 to 360,000 women and men were affected by genital warts caused by HPV every year. About 14 million people become newly infected each year. HPV is so common that almost every person who is sexually active in their life will get HPV at some point in their life if they don't get the HPV vaccine. So it's very common. Every year, nearly 12,000 women living in the U.S. will be diagnosed with cervical cancer, and more than 4,000 women die from cervical cancer each year. And that is even with the screening and treatment. All right, so diagnosis and treatment. Genital warts can be diagnosed from an examination from a doctor. Women can be diagnosed with HPV by having an abnormal routine pap smear. If the patient has the type of HPV that can cause cancer, the doctor may want to perform colposcopy. Colposcopy. All right. one day I will learn to pronounce these words. So when you have a pap smear, the doctor will take a sample of cells from the cervix. The sample is sent to a lab and looked at under a microscope. If abnormal cells appear, the doctor may do another pap smear just to be sure and include a cervical HPV test. This test can identify many of the HPV types that can cause cervical cancer. This is the only HPV test approved by the FDA. Let's see. So also in if they get tested, so in the colposcopy, the doctor will use a special magnifying lens to get a closer look at the cervix. And if the tissue looks abnormal, then they will cut out a small piece to perform a biopsy, and the test will check for signs of cancer. And unfortunately, there's no treatment for the virus itself, but there are treatments for the symptoms. So genital warts can be treated with prescription medication. They may also go away on their own. Women who get routine pap smears and follow up as needed can identify problems before cancer develops. And prevention. So HPV can be prevented by wearing condoms consistently and correctly. Also limit the number of sexual partners. Women should have regular pap smears every 3 to 5 years, and also vaccinate. So there is a vaccination for HPV now. It is recommended for girls that are 11 to 12 years old. They can start as early as 9 years old, and it's actually available for everyone through the age of 26 if they haven't been vaccinated already. Because early cervical cancer doesn't cause symptoms, it's vital that women have regular screening tests to detect that precancerous changes in the cervix that might lead to cancer. Current guidelines recommend that women ages 21 to 29 have a pap test every 3 years. So there are ways to prevent it. And then here's my sources.